Good morning to all of you. Today's class is about blood grouping. What are blood groups? How blood group is determined? And why should we know about blood group systems? And blood transfusion reactions. Before that, what is blood bank? And why you need to donate blood? So these are all the objectives which I'm going to teach you today. And remember, this is very essential for all of us throughout our life. Okay. Sorry for the spelling error here. How do we recognize ourselves? How is human being recognized? I tell you, there are only two ways probably. One is based on the gender. You may say he is a female, he is a male, she is a female and all that. Then comes identity or classification, whatever, it is based on the blood group system. Remember only these two. Don't get yourself recognized as whatever. So many other systems which are there, which exist in the society. And if at all, if you want to get recognized, another way is get yourself recognized by the entities like good, bad. So be always good and have a lot of good qualities. Okay. So blood grouping. Why is it essential for us to know blood grouping? I'm sure all of you know about your blood grouping because you would have got this done during your school days or at least later. So when you have taken probably an ID card, whether it is in the college or very essential is when you've gone to get the license, driving license. So all of you know your blood groups, and we have taught you about this blood group in physiology and pathology. We make you do this grouping yourself, and you have already done this exercise in physiology. Okay. So what is immunohematology? So we dump all these in a category which is known as immunohematology. Now this has become a specialty. So there is, after MBBS, people take up this MD in immunohematology or transfusion medicine. So the branch of hematology which includes the study of blood groups and types and preparation of blood for use in transfusion comes under immunohematology. So there are certain things now you should remember, the nomenclature, which we would be using it regularly from now on when we talk about cross-matching, Coombs test and all that. So what is an antigen? We call antigen also as agglutinogen. It is a substance present on the cell. So what is agglutinin or hemolysin? It's also called as antibody. So antigen is agglutinogen, antibody is agglutinin or hemolysin. Then when these two interact, what happens? There is agglutination. So agglutination reaction. So naturally occurring antibodies develop at birth without exposure to antigen. That means when we have used this term here, naturally occurring, there's something that acquires antibodies also. So blood group refers to genetically encoded erythrocyte antigen systems and the immunogenic diversity expressed by almost all the cells, but important is RBCs, WBCs and the plasma. So antibodies are in the plasma and the antigens are on the cells. So these blood group genes follow Mendelian rules of inheritance, and over 700 erythrocyte antigens are reported. There are so many antigens, but we talk about the most common one. So inheritance is the Mendelian rules, and I tell you what is the type of inheritance. So blood group systems, when we ask you to name different blood group systems, at least remember few. I'm sure you know about A, B, O and RH, routine ones. So the other blood groups are M and S. M and S blood group is important for paternity, in cases of paternity dispute, we use this. Then other private antigens which are there, and the groups named as P, Kell, Duffy, Lutheron, Lewis. Remember at least few. This is a question that is asked you in the Viva also. This is June month, right? So June 14th was very special day. We all celebrated it. So we actually celebrated it on June 16th, combining June 14th and 16th because June 16th happened to be the 90th birthday of Honorary Secretary of Bapuji Educational Association, is Dr. Shamanuru Shivshankarappa. So many of our faculty came forward to donate blood. So what is June 14th? 16th I told you what was the importance. What is June 14th? Celebrated as World Blood Donors Day. So this was in the remembrance of Karl Landsteiner. So birthday, it is his birthday. What did he do? Karl Landsteiner was the person who discovered the blood group system. So in his honor, June 14th is celebrated as Blood Donors Day. So antigens expressed on RBCs, platelets, endothelial cells, epithelial membranes. So we see them on all the cells. So the histocompatibility antigens, and there are three antigens we remember. One is A and B. So A and B antigens are on chromosome 9. Another very important antigen is H antigen. So that is situated on chromosome 19. And what are the blood groups expressed? I told you we need to recognize ourselves. So as different blood group people belonging to different blood groups. So then what are all the blood groups? A blood group, B, AB and O. So the four, that is the expression, phenotypic expression. So people are categorized based on four blood groups, that is A, B, AB and O. So what is another system? Another one is RH antigens. So based on the presence or absence of RH, we say RH positive, RH negative. So most of the people are RH positive and hardly about 5 to maximum 15%, 5% people are RH negative. Okay. So he is the great man I was just talking about. So Karl Landsteiner, who discovered the blood group system. So this is another question which is asked to you. So you will be asked to talk about Landsteiner's law. They ask you, what does Landsteiner's law state? So the law states that if an antigen is present on a patient's RBC, the corresponding antibody should not be present in the patient's plasma under normal conditions. So Landsteiner's law states that if an antigen is present on the RBC, the corresponding antibody is absent. So I told you different systems. Let us take up A blood group. So what is the antigen present here? That is A. So what is the antibody he has? Anti-A is not present. So he has anti-B antibodies. Similarly, if we take B group, the antigen present is B. So the antibody present is, he cannot have antibody anti-B because according to Landsteiner's law. So he will have anti-A. A. So what will a person with AB blood group has? So he has AB antigen. And what are the antibodies? Because A is there, he cannot have anti-A. Because B is there, he cannot have anti-B. So antibodies are nil. Similarly, if you consider a person who has got O group, what are the antigens present? There are no antigens at all. So antigens are nil. So no A, no B. They're not present. So what is the antibody present? Both anti-A and anti-B are present in his serum. Hope this is clear to you. This is about the Karl-Landsteiner's law. A and B are autosomal co-dominant antigens. That means, so both are expressed. O phenotype is only recessive, and all complete development of all these antigens occurs by 1 year of age. So what is the meaning of this? So if we have taken the blood sample from newborn or infant up to the age of 1 year, we do determine the blood grouping. But sometimes after 1 year or 2 years, when we do this blood grouping, there may be some discrepancy because totally the antigens are not expressed till 1 year of age. They may get expressed later. Sometimes a 6-month-old child, baby, I may say after doing the test that this is O group individual. But after I repeat the test 1 year afterwards or when the child is 5 years, so I may label it as A group. This is just an example. That means only in children up to the age of 1 year, the antigens are not expressed properly. But otherwise, if me and you or others are labeled as whatever group, or we have got a blood grouping done and we have a blood group card, so we need not get our blood grouping done daily or once in a month or whenever we get admitted or whenever it is necessary. So once we get a certificate, a card which says whatever is your blood group, that remains. That remains for the whole of our lifetime. It does not change in adults, except in certain conditions where certain viral infections or bacterial infections where they interfere with the blood grouping. There may be discrepancy. So remember, if you have got your blood grouping done, if you've got a blood grouping card, carry that as a document, and wherever it is necessary again to mention the blood grouping, mention it and then show this as a record. Don't just go and get this test unnecessarily done again. See, how these I told you about A antigen, B antigen. How are they getting expressed? There is some precursor substance in the blood. And people who have H gene, so the precursor substance with H transferase gets converted into H substance. So H substance gets converted to AB. So if the person, so imagine person has H substance because he's got H gene. And if the person has A and B antigens or genes, so they convert H substance to blood groups A or B or AB. So if the person has inherited A and B genes. So if these genes are not there, then what happens? The H substance is not converted. It remains as such. So no antigens are expressed and the blood group remains as O. So all of us have H substance. So think about your blood group. If you're O, then that means you do not have, or your H substance in you is not converted to A and B antigens. If you're A group, that means the H substance that is present in you is converted to A antigen by the gene that determines. Okay, this is the inheritance. Now, Imagine a person, all of us have precursor substance, okay? So imagine a person who does not have H gene at all. What happens now? No H gene at all. So the precursor substance remains like that. H substance is not produced at all. Okay, he is unique. There are only very, very few people. Where are they present? They're in, now we have seen one or two in Davangere also. And we had seen one medical student also with this who did not have H gene. So no H substance. Then what will be his blood group? No H substance. So no antigen A, no antigen B, nothing. So this is a special group which is called as Bombay blood group. So you should know about Bombay blood group because that's a short note topic for you. Remember recently we had this 1 year, 2 years back. So a patient in Myanmar wanted Bombay blood group. So they searched entire world, I should say, not just the country, right? So then they traced because the networking, blood bank networking is in such a way that everybody knows where are the blood banks existing and what do they have. So there was one unit of Bombay blood group in our SS blood bank, in the new medical college. So people from Myanmar contracted us, and then we made it like there were people who could easily transport that blood from here to a lady there to save her life. So that was Bombay blood group. That's why they were in search of it. So recently we had another pregnant woman who needed Bombay blood group, but luckily her cesarean section went without much bleeding, and somehow she did not require Bombay blood group. So then another patient who was admitted needed Bombay blood group, and very lucky that we had a donor who came from nearby village of Davangere to donate Bombay blood group. There are very, very few people. So what is Bombay blood group? Bombay blood group is where the individual lacks H gene, so there is no H substance that is formed. So he is like blood group O. But why don't we call him just blood group O? All blood group O people, we use an antigen H and mix the blood or the serum. So when we add antigen H, because they have H substance, there is agglutination in Bombay in O group, whereas in Bombay blood group, because there is no H substance, so they do not show any agglutination. So remember about Bombay blood group. It was, I'll tell you later, it was discovered by Bende. He was a great pathologist. Where did he discover? So in Bombay. He's a pathologist from Bombay. He found this in Parsi community. So now we are seeing everywhere. See, Bombay blood group O. Okay, well, when we do the test, I'll tell you, I think you can understand that. But now at present, you remember that Bombay blood group lacks H gene. O, AB, A, B, all of them have H gene. So when H gene is absent, we say it is Bombay blood group, and H substance is not produced. 2 points. Now, so antigen H, okay, O group phenotype. What does he have? No AB, but he has only antigen H. So antibodies, both anti-A, anti-B. So 25% of individuals belong to O group. A group individuals, the genotype that is on the chromosome, there could be both AA or OA. So parents, one parent with dominant AA, another parent with O and A. So antigen is A, anti-B. So 37% of individuals belong to this category. And sorry for a mistake here. So B group comes 33 and AB comes about just say 5 or 5 to 8. I'm very sorry for this typing error here. So AB hardly about 8% are AB group. So A group again has subtypes A1 and A2. So A2 is the most common. So A1 antigen reacts strongly with diluted anti-A. And you should know about secretors and non-secretors. So secretors, we say even in the saliva we find the antibodies. So ABO antibodies appear during the first few months as a result of exposure to ABH antigens. So and there are so many things, you know, in the food which are like the antigens. So they also provoke, they also uh, are the cause for antibodies developing. So anti-A, anti-B are IgM antibodies. So what is the type of antibody? They're IgM antibodies. So potentially lytic at 37 degree centigrade. So this is what I was telling you, Bombay blood group. So in 1952, it was Bende, Bhatia and Deshpande who discovered this. So there is something called as para-Bombay also, Bombay blood group. So what is present here? Anti-A, anti-B and anti-H antibodies are present. If it is O group, only anti-A and anti-B are present. Okay. So here anti-A, anti-B, anti-H are present and they agglutinate all A, B and O group cells. So A-B-O grouping based on antigen-antibody reaction indicated by agglutination or lysis. So first is sensitization, which depends on temperature, pH and all that. Second is agglutination. So how do we do A-B-O blood grouping? Do you all remember? So we usually take the blood from the capillaries. So how do we obtain capillary blood? This is from the fingertips. And we say avoid little finger and the great or the thumb because they're in continuity to the palmar aponeurosis. If there is by chance any infection, it just spreads here. So choose only this. Usually we choose ring finger or the forefinger. So using aseptic precautions. So just put just prick using a lancet, disposable lancet. Why do we say disposable lancet? Because the size of this, the punch which goes inside is just 2 millimeters. And then take a drop of blood on the slide, three drops at 3 different areas, and then mix them with anti-sera, anti-A, anti-B, and RH. This is a very crude method of doing the blood grouping. So there are 2 methods of doing blood grouping. This, what I told you, was slide agglutination test. It may not give us proper value. So best if the test is done using a test tube where we take red cells suspended in saline. So the agglutination also would be visible very easily. So this is what we do. So reaction with anti-A, I'll show you a picture. I think you can understand it better. So detection. So several methods are there. I told you slide method and tube method. There's something called as forward grouping, reverse grouping. So when you do this test in the examination, practical hall, these are the questions that are asked. They ask you what are the types. You say slide method, slide agglutination method, tube agglutination. And then second is forward grouping and reverse grouping. See, anti-sera, blue, yellow, no color. So why are they colored? So this is methylene blue. By where do we keep the anti-sera reagents? Reagents are kept in the fridge. So what if, because they become damp or wet and the label goes off? Still by the color we can recognize what anti-sera it is. So methylene blue is added to anti-sera A, so it looks blue. So acriflavin is added to anti-sera B, so it looks yellow. And colorless is anti-D or RH. So this is what I was telling you. So we add a drop on, we should never use this method. It's a very crude method, just see. Okay, 3 drops of blood we have taken from you and added on the slide. So this is mixed with A, 1 drop. This is B, 1 drop. This is D, 1 drop. And what do we do now? We take, separate, stirrer or say sticks to mix this. So use one to mix this, use another and use this. So don't use the same because you will be carrying the cells from there to here. And we observe grossly, macroscopically. What is the difference that you can see here? Where is agglutination? So we are seeing agglutination here with RH. Can you make out the granularity here? What does it mean? This means the person is RH positive. So whereas here, if you see both A and B, so they're just uniform. There is no agglutination of granularity. So there is no A antigen, no B antigen. So what is this blood group? It is O. So if we read this, how do you read this? Is O positive. The individual is O positive. See, very easy now. So drop of blood is taken, another drop is taken. So anti-A, blue color you can make out, is added to this drop. Anti-B, anti-sera is added. So both are mixed. So we are seeing agglutination in both. What is the blood group? It is AB. Now, agglutination is seen only in A anti-sera added. So it is A group. So agglutination is seen only with anti-B, anti-sera, yellow color. So it is B group. So here, no agglutination after adding anti-A, anti-sera and anti-B, anti-sera to a drop of blood. That means the person does not have A and B antigen. So he belongs to group O. Just look at this. We are here by this method. What are we detecting? We are detecting the antigen. We are detecting the antigen. We are taking known anti-serum. So blue color bottle, what did it contain? Anti-A. That means we know it is anti-A. Yellow color, anti-B. So known antibodies are taken, anti-serum. And then we have detected the presence of antigen. This is called as, one is slide method, right? This is forward grouping. We are finding out the unknown antigen. Hope it is clear to you. Unknown antigen. Now, slide and tube method I already told you. So, imagine the other way. Imagine now we are taking in one bottle cells which are known. That is, A cells are being added, B cells are being added. Known, we are taking this. To this now we are adding the serum from you. For forward grouping it was whole blood, RBCs. So now we are adding the serum. Okay. So if there is agglutination, what does it tell you? So A cells we have taken, added unknown serum which is not known. So by doing a reverse test, we are finding out the blood grouping. So if there is agglutination, what does it indicate? It says this person has anti-A. That's why he has shown agglutination with known A cells. Then what is his blood group? Which is the blood group which has anti-A? Remember Landsteiner's law? That means this belongs to B group. He belongs to B group. So this is called as the reverse blood grouping. So in reverse blood grouping, we take the known red cells and to that we add unknown serum. If there is agglutination, whatever known cells we have taken, so we know the corresponding antibody is present. That means the blood group is different. So if A agglutinates with the serum, he has anti-A. That means he belongs to group B. So this is reverse blood grouping. Cells that are of a known ABV group that are agglutinated by the naturally occurring antibodies in the person's serum. So this is also called a serum grouping. So the first one I told you was cell grouping. This is serum grouping. So you know about forward grouping, reverse grouping, right? Slide method, tube method, cell grouping, serum grouping. Now, so why should we know about blood groups? I was telling you about only identity, right? And So if I know the blood group, I go forward to donate to the person who is in need of my blood group. Even if I don't know the blood group, I can always go donate. Okay. So when we talk of blood transfusion, so donation comes first. I don't know how many of you have donated blood. Many students, they celebrate, many children, I should say, celebrate their 18th birthday by donating blood, because people who are 18 years to 60 years, they can donate blood. Okay, come forward to donate blood, because why donation is important. There's so many people who are in need of blood. So why can't we use any other medicine like blood? That means artificial blood, though it is there, perfluorocarbons, they're not extensively used at all. So if at all, if we want to save a person who is in need of blood, it's only you people who are voluntary blood donors who come forward to donate your blood. And at a time, I tell you, we just take about 300 ml or 400 ml, depending on your weight, body weight. Those who are 45 kgs and above can donate blood. If you're 60, 65, we take about 400 ml of blood. What does blood contain? All of you know it contains RBCs, WBCs, platelets, plasma. So after collecting the blood, we separate them into RBCs, platelets, plasma. Who gets RBC? That means once you donate blood, you are saving minimum of 3 lives. People who have anemia, who cannot immediately respond to any type of treatment, road accidents, cancer surgeries, cardiovascular surgeries, they need a lot of blood. So we give RBCs to them, packed cells. Platelets, platelet deficiency or even viral infections. Just one viral infection you should remember is dengue. It's almost endemic in Davangere. So when people with dengue have a lot of thrombocytopenia, they start bleeding, and we need to transfuse platelets to them. So we make use of that. Then plasma. So many cases, burns and people who are in ICU and even cardiac surgeries, plasma we give. And of late, you must have heard about COVID patients, the plasma therapy. So people who have recovered from COVID infection, COVID-19, they have antibodies in their plasma. So plasma therapy is being started and found to be quite successful. So there's a lot of request for people who have recovered from COVID to come forward to donate plasma. We look at their physical conditions also, health and all that. So we want the donors to be healthy. So that plasma being transfused to COVID patients. Already we are giving the antibodies. So that's by plasmapheresis. That's a separate procedure. So that's how at least start donating blood. Okay. So if you do not donate blood, don't think, that blood would be within our body lifelong. No. All of you know RBCs live only for 120 days, WBCs live only for a few hours, and platelets live only for a week. After this, all these are being denuded, they die, and new cells are being formed. So if you donate blood, I tell you, you have a satisfaction of saving life. As doctors, we don't save life, but the blood you donate saves life. You don't know whose life it is, so we don't even tell you what to whom your blood is given. And then the bone marrow regenerates, and there is little risk of the very rare risk for blood donors of heart diseases and repeated blood donation. So your cholesterol level, everything would be maintained. That's why you need to be healthy first. Only if you're healthy, then you become a donor. And you should have a mindset to donate. Okay, don't say. And you should all be voluntary blood donors. That is, who do not expect anything out of donating blood. Initially, it used to be professional donors. Professional donors used to get money. Now it is abandoned. So you are donating, your voluntary blood donor, you come forward to donate blood to anybody. You're not thinking of whether it's your mother, father, relatives, or friends. So you say, in need, whoever is in need, so let my blood be useful and then let their life be saved. So that is a great thing. That's a great donation that one can do when we are alive. After that, starting from eyes, to all the organs and body donation that exists. So please get motivated for blood donation. If I don't talk about blood donation and only talk about theoretical aspect, no, that means the heart domain, the attitudinal domain would be lost. Okay, so please come forward and then donate blood. Okay, so what do we do after? So we go to blood donation camps. We go to many colleges to get the blood, and when we take their blood there, so we just replace the blood, the volume that the student or the donor has given. So we just give him juice and all that and the certificate, and so he goes happily with that. Okay, so what happens to the blood that we collect and come? We don't pay him money, but we collect that. Starting from the bag which we used to collect the blood, I tell you, the bag itself costs about 280 rupees. So we charge money from the patients who come to the blood bank asking for blood. So you may think, oh, they're collecting blood free and then collecting the money. No. So all the expenses that are incurred by the blood bank are collected by the patient, not the donor. For the donor, he can come anytime asking for blood if it is in need, if he is in need for his friends or relatives or anybody. And girls can donate once in 4 months. Boys, we say once in 3 months you can come and donate, not before that. Okay. So what do we do with the blood? Suppose 4 of you have come forward to donate blood. So one belongs to A group, the other is B group, one is AB, and the other is O group. So I have a stock of these 4 bottles in my 4 bags in my blood bank. There's a patient who needs, or a person who is in labor, delivery, lost a lot of blood, and they come running to the blood bank asking for group A blood. I have collected A group from you and kept it. I've labeled also, I've done the group A. Can I just give that blood to that individual just because we know the grouping? No. So there's something called as cross matching that has to be done. So what is cross matching? This is to know the compatibility of the donor and blood of the donor and the recipient. There are 2 types. One is major cross matching, the other is minor cross matching. Major cross matching, what is done? We take patient serum, add donor cells, and there should be no agglutination. For minor cross matching, we take patient cells and then donor's serum. There should be no agglutination. So cross matching technique, saline method, it detects IgM antibodies, then albumin or enzymatic method, and then indirect Coombs test. So it was Professor Coombs who discovered this test. There are 2 types of Coombs test. This is again a short note. There are 2 types of Coombs test, direct and indirect. So go back after my lecture is over. This video would be there. So just listen, read. Direct anti-human globulin test is DAT. It is used to detect IgG or complement sensitized red cells. So red cells have antigens on them. So it is easily detected by direct antiglobulin test or direct Coombs test. So this detects all the bound DAT cell-bound antibodies. So all the antibodies that are there on the cells are detected here. It's a very easy example here. So direct Coombs test. We have RBCs which are sensitized. Okay. So RH, we can talk about RH antibodies. So mother is RH negative. We have a second pregnancy. First pregnancy, if RH positive baby is there, nothing will happen. The cells would escape. The baby cells, when they escape into the mother's serum, she produces antibodies. We should not allow for that because next time when she has an RH positive baby, the antibodies may destroy that. First baby escapes. Okay. So now the antibodies which are there on the in the mother. So the RH antibodies are attached on the RBCs now. So we are detecting these antibodies. What do? So we add anti-human IgG, Coombs reagent. We add. Coombs is anti-human globulin. It is antibody to antibody. Now the antibodies are there on the red cells. So you add an antibody to it, so they agglutinate. So this is simple direct test. Easily we are detecting the antibodies attached on the RBCs. So the baby sample is positive for the presence of mother's antibody on the surface of the RS cells in erythroblastosis fetalis. Antibody is coated, mother has RH antibodies, so antibodies are coating the fetal baby's red cells. So we are adding, this is antibody, we are adding another antibody to it. See how it brings these together. This is direct Coombs test. Indirect Coombs test is, we have the antibodies where in the serum. So mother has antibodies in the serum. So if we have to test the mother in RH incompatibility, so if we have to test the mother, we have to take mother's serum. If we have to test the baby, we have to take baby's red cells. Okay. So mother's serum has lot of antibodies. Now, if we just add this antiglobulin, what I showed you initially, they do not come together. There is no cell here. What do? To detect the antibodies in the mother serum, first we take RH positive, ORH positive cells from somebody else will take. So we add mother's serum to it. So mother serum has all these antibodies. So they all go and anti-D. This is RH positive cell that we have taken, ORH positive from a known person, somebody else, only to do the test. So all these antibodies go and attach on the RBCs here. So now to this we add similarly what we did previously, anti-human globulin. So now there is agglutination. So this is called as indirect test. Indirect globulin, antiglobulin test. So because the antibodies are in the serum, so we have to see that the antibodies go and get attached to the positive cell. So we are taking, one step is extra here, we are taking known ORH positive cells. So mother who is RH negative can have prenatal testing to determine the presence of non-agglutinating antibody in her bloodstream. So if we want to know that RH negative mother is there and the fetus is RH positive, then we have to test whether the pregnant woman has many antibodies. We take her serum and do this test. So Coombs test is to detect antibodies, whether complete or incomplete. So complete antibodies on the RBCs are determined by direct test. Incomplete in the serum is determined by indirect test. So this, you just sit with this chart, you can understand this. So where do we do Coombs test? This is in hemolytic disease of the newborn. You can say RH incompatibility, then autoimmune hemolytic anemia, drug-induced hemolytic anemia, hemolytic transfusion reactions, and detection of atypical antibodies on the donor or patient red cells. Okay, read about Coombs test. What is Coombs test? What are the indications? So where do we do Coombs test? These are the things you have to write. What are the types of Coombs test? Direct, indirect. So what do we take for direct? We take blood cells, RBCs. For indirect, we take the serum. So direct antiglobulin test is done on the baby. Indirect is done on the pregnant mother's serum in case of RH incompatibility. See, indirect antiglobulin test or Coombs test is done to demonstrate atypical antibodies in the serum for compatibility, cross-matching anyway, what we do in the blood banks, that this test, and for detecting minor red cell antigens. See, there is no agglutination here. RBCs are all separate, like how we talk about social distancing now. They're all separate. This is, they've all come together. So this is agglutination, this is normal. So if you see RBCs like this, in spite of telling them to be, people to maintain social distance, we are seeing crowded people. So this is agglutination, this is normal. Okay, see? This is how the tube agglutination appears. When it is homogeneous, now it is very clear that there is no agglutination, even here. But here we can see the agglutination, and it's so strong here. So microscopic appearance of agglutination. RH system, you have read about it in first year or physiology. We know that RH gene is situated on chromosome 1, whereas the combinations of so these are the antigens that we see. C, capital C, small c, capital D, small d, capital E or E. So individuals are classified as Rh positive or Rh negative based on the presence of this D the major antigen. DU, you should know, is a subtype of D in which a weak or negative reaction is seen with rapid tube or slide test. We find it very difficult at times. Rh positivity. We do not see the agglutination, but there will be slight or doubtful agglutination. So even in the presence of the antigen. So it is typed using Coombs. So Rh antibodies, they result from alloimmunization by previous pregnancy or transfusion. Predominantly, their IgG optimal at 37 degrees centigrade. So anti-D is clinically important for causing hemolytic transfusion reactions and HDN. What is HDN? Hemolytic disease of the newborn. So if this is a short note, you should say hemolytic disease of the newborn occurs when the mother is Rh negative and the baby is Rh positive. And first pregnancy, nothing will happen because the Rh positive cells which are released into the circulation, mother produces antibodies, and most of the time it is at the time of delivery that many cells are exposed to antigens, that is cells are released into the maternal circulation. But now when the mother's immune system is exposed to this antigen, later on she produces lot of antibodies. So second pregnancy or subsequent, when the fetus is again Rh positive, there are already antibodies, so they start destroying the red cells and that results in abortion or hemolytic disease of the newborn. So newborn presents with anemia, severe anemia, jaundice, if it survives. Otherwise, hydrops fetalis. Totally the body would be swollen. It is like anasarca. And how do we determine what is the test done? You have to write about Coombs test. So hemolytic disease of the newborn. So when we look at a peripheral smear from the baby, we see plenty of nucleated red cells. That's why it's called as erythroblastosis fetalis. It's also called as erythroblastosis fetalis. In the blood smear, we see plenty of erythroblasts or normoblasts. Yeah. That's about RH and ABO blood group systems, how to determine them, Coombs test and Bombay blood group. So Bombay blood group is a short note for you, then cross-matching, and then hemolytic disease of the newborn, Coombs test. So there are 4 short note topics that you need to learn here. So blood bank, please visit our blood bank and look for all this. So I told you, what do we do after taking the blood in a blood donation camp or anything from a donor? So we do certain tests. Okay. So what are the tests that are done? All these are what we need to maintain. Okay. So this is a blood bag. Now we have triple bag, double bag, quadruple bag. What do we use as the anticoagulant? ACD, CPD, CPD, A or Segum. Yeah. And these are all the codes that we have. If you see pink label, that means it is B group, yellow label is A, O is blue label, and AB is white. This is for a reference. Okay. So this I told you, the blood collection donor criteria. So who can donate the blood? So 18 years, not 17 years. Okay. So more than this, and donor should have a hemoglobin content or concentration of 12 grams minimum, 12 grams or more. And he should not be suffering from any of the diseases. And he should not be a hypertensive. Okay. There is a donor questionnaire which mentions all this. He should not have had any previous surgery or anemia and all that. So we examine the donor only when he is fit. We take this. We collect the thing. So he should not be immunized for previous 6 months. He should not have any infectious diseases or on treatment, and he should not be diabetic. Now we take from diabetics also. So hemoglobin, and after we take the blood from the donor, in the blood bank, we test for all this. We test for HIV, hepatitis B virus, hepatitis C. Serological test is done for syphilis, malaria. So these are called as transfusion transmitted diseases. This is another question frequently asked to you. So you will be asked to name transfusion transmitted diseases. So you should say they are HIV, HBV, that is hepatitis B virus infection, HCV, hepatitis C viral infection, syphilis, and malaria. Okay, remember the transfusion transmitted diseases. So we test for all these. Only when they're found to be negative, we move further. So blood components, I told you, packed cells, plasma, then cryoprecipitate is another one, which we give for people with coagulation disorders, platelet concentrate. Yes. These are all special things which when required only are done. So preservation, ACD is acid citrate dextrose, CPD is citrate phosphate dextrose, CPDA is citrate phosphate dextrose with adenine, and latest one is SEGM. So all these are done, in blood bank. Major and minor cross matching, then only the blood is issued. So Coombs testing, that is direct and indirect, is done. So only when there is no agglutination that we give that blood to the patient who has come with a request form. Okay. So what happens otherwise? So these are all the indications where red cells are required and all that. Platelet transfusion, plasma. I've just given you one or two examples where all these are required. Cryoprecipitate for factor VIII deficiency or any other factor deficiency. Yes. So transfusion reactions. This is a short note for you. What happens if we do not give that particular group blood to the recipient by mistake? Mistake should never happen. Does the patient die? Yes, patient dies. But I tell you, first transfusion, nothing will happen. Only second he receives the blood, this. So acute transfusion reactions, we call them as acute hemolytic reactions, anaphylaxis, febrile non-hemolytic reactions, transfusion associated acute lung injury. So this is called as TALI. Then acute fluid overload and allergic reactions. So remember about the transfusion reactions that can occur. So blood is like a tissue transplant. Please use it sparingly. Only when it is absolutely required, we have to transfuse the blood. Otherwise, there's chances that so many things, adverse reactions can occur. So it's a very, very crucial, critical department where, people, technicians, nurses, and doctors have to be working properly. So acute transfusion reactions, what happens? They take the blood and then start transfusing to the patient. Suddenly patient throws a lot of chills and fever and all that, he shivers and all that. So that is febrile. It is not hemolytic. Okay, we have given proper blood only, but there is some allergen probably which has caused or allergic reaction. Or if you say, yeah, let me go on transfusing, and in a short time you transfuse, say 4, 5, 6 packs of RBCs or say fluid, the whole blood, then there could be overload, fluid overload, or acute hemolytic reactions or anaphylaxis. We don't know what antigen is there which has caused anaphylaxis. So that can happen immediately. So our people are in the habit of, warming the blood. In the blood bank, we keep it in the refrigerator. So all the blood is kept at minus, say, 4 degrees, and all the other components we use minus the plasma and all at minus 40 or minus 80. Otherwise, all the other components at the simple platelets would be at the room temperature. But when the bag which is taken is so cold, people do not, in spite of telling them, they have the practice, malpractice, I should say, of heating the blood and transfusing. Nothing will happen. Blood, there is no option for heating the blood because our body that is at 37 degrees and nothing. So 300 ml going at minus 4 degrees centigrade, nothing would happen. So there are warmers that could be used. Otherwise, they put it in hot water and all that. They cause lysis of RBCs. That is where all these would happen. So nursing staff and all the junior doctors who are working in transfusion, in transfusing the blood need to be educated about this. If they want, they can keep it on the patient's abdomen, cover it with a thick cloth or blanket or whatever. That could be done, but there's no need at all. Then delayed transfusion reactions. What are they? Delayed hemolytic reactions. Transfusion transmitted infections. We listed which are the transfusion transmitted diseases: HIV, hepatitis B, hepatitis C, malaria, syphilis. So if we do not test for these presence of these infections, then naturally you're infecting the donor recipient who gets this blood from infected donor. So we do all these tests properly. That's how many people, when AIDS was uh, identified in 80s, so many became positive because during that time we were never testing for HIV and all that. So whoever had received blood and blood transfusion, blood and blood components became positive. So then transfusion associated graft versus host disease, and post transfusion, after transfusion purpura, that is hemorrhagic spot, then iron overload. So repeated transfusion, who are the people who require repeated transfusion? So we have a lot of children who are suffering from thalassemia. There's no production of RBCs at all. Whichever RBC is produced, like they're all destroyed. So these children live only on blood transfusion. So it's like daily we have food to live, right? So every month, monthly once, a monthly twice, depending on their hemoglobin content, they all live only on blood. So every time we transfuse blood, so they get iron overload. So lot of iron, and already the iron that is there in the body is not utilized for hemoglobin production because there's a genetic defect in the hemoglobin production. So that could lead to iron overload and immunosuppression. So this is transfusion reactions. And how do we test for transfusion reactions? We do test for hemolysis, test for incompatibility, test for direct DIC. DIC is disseminated intravascular coagulation, test for renal function, bacterial screening, immunological screening. So once this starts, we ask them to stop transfusing and then send the blood as such to the blood bank, then collect the blood sample of the patient, collect the urine sample. So we look for all the evidences to say whether this has caused transfusion reaction. So this is transfusion transmitted disease again. So something else is added to the list. So CMV is cytomegalovirus infection. This also could be transmitted. We usually do not test for it. Then parvovirus infection, Chagas disease. Okay, so these are the things that are HTLV, just added to the list of transfusion transmitted diseases. So this is about knowing about blood group systems, the Landsteiner's law, then what are the different ways of determining the blood group, and why we should know about the blood group system, and who can donate. Okay, at least after telling you about the donor criteria and why you should donate, please come forward. There's a lot of satisfaction after donating blood. Okay, don't just donate to impress somebody. So you help the needy. Naturally, God is there to help you and your family when you are in need. Okay, you're all healthy volunteers, please come forward to donate blood. Then transfusion, I've told you. Then cross matching. Then Bombay blood group, especially you have heard about it. So Coombs test. Then the transfusion reaction. So Landsteiner's law, then inheritance of the blood group system, the different blood group systems, then Coombs test, different methods of blood grouping, then the Bombay blood group, then transfusion reactions, who can donate blood, that is the criteria for a voluntary blood donor, then cross matching. So lot of things we have learned in this session. They're all short answer questions for you. So listen to this again, learn about it. So open your textbooks and then make short notes. Just write. At least jot down the important points so that it becomes very easy. So once you have heard, then second you read, third you write down, jot down the important points. So everything gets registered very well. So initially in the temporal lobe and then later it goes to the permanent memory, that's the hippocampus. Okay. So stay safe, take care of yourself and your family as I've been telling you to maintain social distancing and wash your hands properly, wear masks. So spend your time usefully. So keep learning. Fine. So let your learning be enjoyable. Thank you.